Hello all, this is Mrs.Lalithamani, professor from SNS College of Nursing. In this lecture series number 3, we are learning about the sensory pathways that includes the sensory system, that is the olfactory, optic, gustatory, skin and the proprioceptor changes, and these sensory pathways include the olfactory system. We will see that what it is happening, how it is happening. So we have seen what are the parts of the olfactory system and how the process of sensory reception is being received, how it is being sent to the proprioception place, that is the central nervous system or the control center, and how the response is being generated and the patient or the person will react to a stimuli. So that is what it is called as the olfactory pathway that includes sensory nerves, both afferent and afferent. Afferent is towards from the proximal or distal organ to the center of the control. So the nerves that takes the impulse from the particular site till the center of the control center, that is the brain control center. So that will be called as an afferent nerve, and the processing unit or the processing area will be the brain, where the impulse will be generated, or the stimuli will be sensed in any of these forms, and it will be reacting to that particular stimuli. So if we find the stimuli being responded in such a way before after time, then we can tell that the olfactory pathway or optic pathway or whatever it is intact. So when we see about these things, we can find out the nose is the major thing, and it is the first cranial nerve. The olfactory is the first cranial nerve, where the smell will travel fast than any other sensory organs. And this olfactory pathway includes this flavor. When there is a stimuli, the nerve from the organ, the nearby or the organs, Jacobson's organ, will be sensed, and it will be taken up. The message will be taken up by that, so the nerve tract, so it will pass on and it will be entering through the base of the skull, that is olfactory margins, or the region where it will be entering into the base of the brain. So there we will be having the olfactory bulb region. Next one, which is in the row, that is olfactory bulb. We have seen the olfactory nerve, where it is the region, and olfactory bulb. So coming on to the other part, it is the brain, which will be handling, and the next system will be the limbic system, where the limbic system is mainly with the thalamus, hypothalamus and the pituitary cortex. So broadly we can say that it is a endocrine system that is being involved, and all these are responsible for the size and shape of the control center. So when there is any problem in the limbic system, it will directly have an impact on the organ, that is the central control center. So as the event, or as the discussion is about to get completed, and the form how the sense olfaction is being assessed will be authorized, or it will be followed up by the team, and based on that the olfactory pathway process will be denoted. So when the olfactory pathway enters the hypothalamic region, there will be a piriform cortex, which is responsible for the entire process to happen. So in this scenario, the thalamus, hypothalamus and the piriform center is not merely a center where the message will be taken in, and it will be processed, and it will be released, or it will be responded in such a way that it is acceptable, it can be understandable, and the response generated will be directly proportionate with the stimuli. So far we have seen about the peripheral stimuli and the impact of it on the any eventual scenario. Thank you so much. In the next series, we will be learning further more about this sensory pathway. So any doubts, we can clarify it in the later. Thank you so much. Keep in touch. See you in the next class. Thank you.